Find out the ways that you can keep decay at bay on Dental Hygiene Wednesday. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care, and I want to welcome you to our Dental Hygiene Wednesdays. Every week we do a different video to cover a different topic or product that we believe is important for our viewers and for our patients to know about so that they can use those tips or the product to help keep their mouths nice and healthy at home when they're not here in the office with us. Last week we talked about grinding and signs that you are grinding and what you can do to help prevent grinding from causing any damage to your mouth. If you missed that video, feel free to check it out. It is on our Facebook or our YouTube page, as well as all of our other previous videos. So go there and check them out. This week we are actually talking about something that we see quite often in the dental office, and that is decay or cavities. So what is decay? Decay is where bacteria has been able to weaken the enamel to the point where it starts to cause an infection in the tooth. And so what happens is it starts to cause the infection and it starts to spread. We like to try to catch them when they are smaller. That's the best case scenario. Well, best case is not having them. But if you do, catching them earlier on means we have to take less tooth structure away when we do a filling, and that's the best thing possible. So if we're recommending having fillings done because you have cavities, please listen, because we are trying to get it done now before it gets bigger or causes any pain or discomfort to you. A lot of people say, well, I'm not experiencing pain, so do I really need to get a filling? Yes, if we are seeing it on x-rays or if we're seeing it in the mouth, it's big enough that it's going to eventually cause you pain. We always say it's not going to, this is the smallest it's going to be, and this is the most comfortable it's going to be and less costly when we catch it. So why it's important is this white outer part is called the enamel. That is the hardest part of the tooth. If the cavity is starting to form in that, it takes a lot longer for the cavity to grow. So if we're catching it when it's in the enamel and we fill it, all we have to do is take that part of the tooth structure out and put a filling in there. However, if you say, well, it's not that big, I don't need to get a filling, and this gets into this yellow part, which is the inside of the tooth, that's called dentin, and this is a lot softer than the enamel. So as soon as decay gets in this area, it starts to kind of fan out and spread, and it gets bigger quicker. And the risk you take there is either having part of your tooth crack off or fracture off, or if it spreads quick enough and fast enough, the spread part is the nerve, and this is what starts causing the pain or discomfort. And if the filling or the cavity gets deep enough into the tooth and it's close to the nerve, you end up having to have a root canal. So very important, if you come in, we see cavity and show you in your mouth where we're looking. Please listen, let us take care of it before it causes bigger issues. We want to make sure that we are preserving as much tooth structure as possible, keeping that original tooth structure there so that your tooth can stay nice and strong. Cavities are something that can happen if you're eating a lot of sugar. It breaks down into acid and causes the enamel to wear down and then cavities to form. Carbs cause that type of stuff too, because it ends up breaking down into sugar, which causes the same exact thing. So making sure that you are brushing at least twice a day, maybe even 3 times a day if you have a high cavity rate, to get any food or acidic drinks out of your mouth. Very important to make sure that you're brushing. I will say though, if you are drinking something or eating something that's acidic, before you brush, drink some water to kind of wash the acid off your teeth, so you're not brushing the acid onto the tooth structure. Some other things, really popular spots that you can get cavities or on the side where the teeth come together or touch. Flossing is really the only way to keep those areas nice and healthy. So make sure you're flossing at least once a day. Again, if you have a high cavity rate or high decay rate, recommend flossing twice a day. The more often you're doing that, the more often you're getting that bacteria out of that area and keeping it from causing any damage. Some things that we recommend here in our office on top of brushing and flossing are using daily use of a fluoride toothpaste. This is good because the fluoride is kind of like a vitamin for your tooth. So it kind of puts a little barrier over your tooth to keep all of that food and drink and everything that you put on your teeth every day, keep it from causing damage to your tooth structure. So we always recommend that. And then we also recommend doing a topical fluoride application. This is super easy, takes about 30 seconds. You paint it on your tooth absorbs it, and then it slowly releases it from the inside of the tooth to the outside. So like I said, put that barrier over there, and this lasts for 3 months. And so that's nice that you are getting that extra coverage to help prevent the decay from happening. But do what you can to help keep your mouth nice and healthy. These are the only teeth you get, so it's really important you take the time to brush and floss like recommended, so that hopefully you don't have to come in and get fillings from us. I want to thank you for joining us today. We always appreciate you guys watching our videos. Feel free to like our videos and comment anything you want to say, or if you have any questions for me personally, you can email me at christina@dublindentalcareohio.com, and feel free to check out our website. It's dublindentalcareohio.com. You can even schedule an appointment to come in and see us directly from the site. Thank you and have a great rest of your week.